Hello, I am happy and honored to give a presentation today. I am Soyong Park. Background and purpose. The purpose of this study was to apply modified constraint-induced movement therapy with trunk restraints to stroke patients' hospitalization in a rehabilitation hospital. To analyze changes in upper extremity function and activities of daily living before and after the intervention in order to verify its effectiveness. Subjects. The subjects of this study were June to August 2025. 8 stroke patients hospitalization and K Rehabilitation Hospital in Busan. Selection criteria. Individuals diagnosed with hemiplegia due to stroke by a physician. Individuals without cognitive impairment scoring 24 or higher on the mini mental state examination Korean. Individuals with a disease duration of at least 3 months. Individuals at stage 4 or higher in the full stroke recovery stage for the arm and hand, who are able to pronate the forearm and perform finger and thumb extension, allowing voluntary grabs and release, as suggested by Ted et al. Individuals without visual or auditory impairments capable of communication, who understood the purpose of the study and voluntarily agreed to participate. Exclusion criteria. Individuals with a history of other disease following a diagnosis of stroke. Individuals with severe cognitive impairment defined as a score of 23 or lower on the mini mental state examination. Individuals with upper extremity musculoskeletal disorders that limit additional movement or exercise. Individuals of advanced age who are considered to have a low potential for recovery or difficulty adapting to therapeutic interventions. Methods. The assessment tools included the modified Barrel Index to evaluate activities of daily living, the box and block test to assess upper extremity function, and the motor activity log to measure motor activity performance. First, participant selection, review of medical records, MMSAK, and MBI. Random allocation. Experimental group is wearing a glove on the non-affected hand. 5 hours per day, 5 times per week. Trunk resistant and affected offer extremity exercise program. 4 hours per day, 5 times per week. Control group is conventional therapy, 5 times per week. Final assessment, BT and NAN. Data processing and result analysis. Data analysis. The data were analyzed using SPSS version 22.0. Descriptive activities including frequency analysis and chi-square tests were used to examine the general characteristics of the participants. A Shapiro work test was conducted to verify the normality of the data distribution. Repeated measures ANOVA was performed to compare changes in WMFT and NAN, including total and subscale scores between the two groups over the intervention period. Pearson's correlations coefficients were used to analyze correlation among the total scores of the assessments. The level of statistical significance was set at alpha equal 0.05. Result. In the comparison of changes in the both motor function test, according to biofeedback training intervention, there are statistically significant difference over the intervention period and between groups over time. Table 3:1 Comparison of WMFT changes for each group by intervention period. The WMFT scores improved significantly in the experimental group compared to the control group. Multivariate tests showed significant effects of both period and group on the stress score. Tests of within subject contrast on each group. Free versus post 1166.400. Significant improvements were found within each group over time, especially between free and post tests. However, there was no significant difference between two groups overall. Similarly, in the comparison of changes in the motor activity log for both the amount of use and the quality of movement, Statistically significant differences are observed over the intervention period and between groups. There was a significant difference in effect size between free intervention and 8 weeks after intervention, but no difference between 4 weeks and 8 weeks. However, significant differences were found in all three detailed sub-items between the groups, and a significant correlation was observed between WMFT scores and both the amount of use and quality of movement scores of the MAL used in this study. Thank you.